Today I want to talk about whether non-incisional double eyelid surgery, also known as the burial method or natural adhesion method, is possible for people in their 40s and 50s. Let me discuss whether such non-incisional double eyelid surgery is actually feasible. Usually when we talk about middle-aged people, instead of double eyelid surgery, we tend to discuss procedures like upper blepharoplasty, brow lift or forehead lift. But now, especially for those in their 40s to 50s, people often wonder if the burial method, non-incisional double eyelid surgery, what we commonly call pinching, is possible. To talk about whether this is possible, the reason this topic came up is because not long ago, Han Ye-sul posted a video on her YouTube channel saying that she had her eyes pinched. That is, she underwent the non-incisional double eyelid procedure. So Han Ye-sul is probably in her early to mid-40s now. So there are actually quite a lot of people who are curious about whether this kind of non-incisional double eyelid surgery is possible even for those in their 40s or mid-40s. So I'd like to talk about that aspect today. At our clinic, in fact, many middle-aged patients in their 40s and 50s receive non-incisional double eyelid surgeries such as the burial method or natural adhesion method. However, there are certain conditions for this. If you look closely, some people have protruding eyes and obviously thin eyelid skin, but some have thick eyelid tissue. If the tissue isn't thick, there's less resistance to fixing the double eyelid line. Also, there shouldn't be any weakness in the muscles that open the eyes, like in ptosis. There needs to be a certain amount of strength to open the eyes, and the eyelid skin shouldn't be extremely droopy either. Even at a young age, people worry about whether to get incisional or non-incisional double eyelid surgery. When considering that, some people are suitable for non-incisional methods, while others definitely need the incisional method. In a way, you can think of it as being very similar to that. The conditions that make non-incisional double eyelid surgery possible are the same even for people in their 40s and beyond. Even in their 40s or mid-50s, there are people whose eyelid skin is not that droopy. At the same time, there are people whose eyes are slightly protruding or who have thin skin and good eyelid lifting strength, and among them, some want the simplest surgery with the fastest recovery possible. For those people, the non-incisional burial method is possible. I hope you keep this in mind. There's something else you need to consider. Under certain circumstances, this can be a bit difficult. For example, if you've already had double eyelid surgery in the past and your double eyelid line is already too high. In that case, you would need to make the line even higher to lift the sagging skin, but that's practically impossible. So in cases like this, it's a bit difficult to do. But on the other hand, if you don't have a double eyelid line, or if it's set too low, you can raise the double eyelid line, remove some of the sagging skin, and make the double eyelid line more visible. If the sagging of the skin is quite severe. Even in this case, there are limitations to using this non-incisional method. In such cases, you ultimately have to excise and remove some of the sagging skin. But if you only do this surgery, the results might be a bit disappointing. Of course, there are people who still want to proceed this way, even if the results aren't perfect, and it is actually done like that sometimes. However, if the time between surgeries is too short when done this way, it might be unsatisfactory. So I think this is something that needs to be evaluated. So in these cases, don't worry too much and just come to a plastic surgery clinic. There, you can consult with a board-certified plastic surgeon and discuss which surgical method would be most suitable for you. Today we looked into whether non-incisional double eyelid surgery is possible for people in their 40s and 50s. Then we'll wrap up here for today. Thank you.